registered nurse and a proud member of the working class. Because I come from proud working class timber workers. And I'm running for state rep in LD19. Let me tell you about my district. Let me tell you about timber country. This place, I love this place, and I couldn't stop if I tried. Once heralded as the lumber capital of the world, our ancestors supplied the boards that built all the homes across America after the Great Depression. But the hard reality is that we are now a shadow of that proud working class that we once were. A homogenous ghost of what once was a thriving forest. Corporate timber companies like Weyerhaeuser stripped us of our trees, gathered the profits of our labor, and left us to die. And even in our misery, big corporations continue to find ways to profit off of us. And the majority of available jobs don't pay enough to survive. Healthcare costs are literally killing us. Too many people are uninsured or underinsured, and even those with coverage are paying way too damn much.
That's right.
When I'm in the House, I will champion the single-payer bill of whole Washington. There's not enough available homes for all of the people. And what is out there is way too damn high. You know, I started my campaigning in the homeless camp in Aberdeen, and then the homeless camp in Longview, and I'm going to go back there every freaking week and talk to those people because they need our help. And you know what? They give me help. They are wonderful. And they're coming out of it, I'm telling you. Schools are underfunded. They said they fixed that with clarity crap. No, they did not fix that. Okay, our schools are underfunded, our teachers got a raise, but the school counselors and the other staff got cut. And you know who is hurt by that? Are our kids. Diseases of despair in timber country are at crisis levels. Alcohol, drug abuse, gambling, overspending, and suicide. Anything to not feel anything anymore. If it were possible for a place to be diagnosed with PTSD, that would be the place. And I will bring my experience as a registered nurse to Olympia. In timber country, we struggle to survive with the lowest life expectancy, the highest addiction rates, the highest unemployment rates, the highest rate of juveniles incarcerated for nonviolent crimes in the entire country. Healthcare, mental health care, addiction service do not come close to what's needed for the size of the problem. In the county with the highest addiction rate, there is no detox or treatment center that takes Medicaid or Medicare.
That ain't right.
No.
But there is an award-winning program that takes private insurance.
That ain't right.
We lack so many things, but there's plenty of alcohol, heroin, and meth. People like the incumbent in my race take hordes of corporate cash to keep us from taking back our power over stuff like guns and women's health care. But listen, right there in timber country, our grandparents and great-grandparents left it all on the field to cultivate solidarity. And we must do the same. Too many people are kicking down instead of punching up. People with no money who do not know their power are not the reason we are struggling, and now's the time for us to come together and take our power back. William Barber and the Poor People's Campaign and National College. Is that this fight is not about left versus right. It's about right versus wrong. And the middle ground has been gone a long time. I'm mounting this fight in this place that I love because it is literally life and death for us. No one has ever run an unapologetically progressive, people-powered, grassroots campaign in rural Washington before, and it's going to be a fight. All the establishment is against us, both sides of the coin. It'll take all of us fighting as hard as we can every day to make this a place where every person thrives. So please go to MariannaForThePeople.com. And the only reason that I'm here right now is because of Bernie Sanders. Yes! He inspired me and generations of people like me to organize to win. When we organize, we win. Generations of when we organize,
Hello, everybody. This is Marianna Everson. I'm a psychiatric registered nurse, and I'm running for Washington State House of Representatives in LD19. If you haven't met me before, I hope to meet you soon. Welcome to our virtual town hall. And please feel free to put your questions in the comment section. We have people who are volunteering to help us that are monitoring those sections so that they can get the questions to us, and we can answer every question that we can possibly get to. Tonight we have a very special person with us. Her name is Therese Stoken, and she is a doctor in Clallam County. She's an osteopathic family physician, and she's willing to talk to us about COVID-19 and some of the ways that we can be safer. And we have prepared a slideshow, so hopefully the visual will be helpful. Please welcome Therese Stoken. Therese, will you introduce yourself?
Yes. Hi, Marianna. Sorry for the technical difficulty with a visual, but glad to be able to hear you. And so I wanted to just reiterate, yes, I am an osteopathic family physician, and I work in an outpatient facility here in Clallam County. And I didn't mean to participate. I prepared some items that I thought would be of most interest to your audience. There's a few links in addition that I'd like to give you and your listeners that you might find very helpful, and then I will try to stay around as long as I can to answer some questions. So, would you like me to just go ahead and start with my presentation? And I'm going to try. I have you on, and I'm trying to see if I can see the slide presentation on my laptop. So, do you want to start that, Marianna?
Sure, I will start.
Okay. I see you, but I don't see the slide presentation yet.
Can you see this presentation now?
Okay. Yeah. Very nice. Okay. So it's very good. And so, can you?
Tree, do you think it would be helpful if we go through the slides and then you can insert the other information where it may be pertinent? Would that be helpful?
Sure. Okay. Sure. So start with stay at home. So this is really the most important item. So right now, let's see. And I think Marianna made these slides. So do you want to read your part of it, Marianna, and then I'll add in?
Yeah, sure. So I made this slide to remind us that being at home is not what we're used to, but it can be a time of rejuvenation and self-reflection and connection to the people that we love, if we have the choice to be with them. So please, reconnect with your family, call people on the phone, text more people, do FaceTime, do Zoom meetings like this. This is a free application you can download, zoom.com. do some projects, clean out a closet that you've been putting off. I did that. Do some self care and remember the reasons why life is so good. And you know what? We may not be able to go back to the way it once was, but maybe we can set new priorities. Found this photo um, on social media that says, "You're not stuck at home, you're safe at home." And I thought that was a very good message for us as we're going through something that we've never gone through before. And this one tree maybe we can both talk about. These are things that we can do at home to keep ourselves and our families um, safer, and they're kind of more medical things. So it's first thing is about cleaning frequently touched places with a disinfectant every day. And if you run out of the commercial disinfectants that we can buy, the sprays at the store, you can always make your own solution with 1 part bleach to 5 parts water. Wash your hands frequently, and I know that frequently doesn't get defined, so I wanted to say touch your hand or wash your hands every time you eat, touch your face, go to the bathroom, or touch any surface that's potentially contaminated, or once an hour. That's what I've been having my kids do. Uh, Use lots of warm water and soap, and wash for all surfaces of your hands for at least 30 seconds. If you cough or sneeze, do it into a tissue and then throw that away right away, and then wash your hands. Avoid touching your face. This is a hard one for me. I tend to touch my face way too much. So I've been working on it. I kind of hold my hands like this a lot so that I can remember. And then avoid going out. I mean, going outside is okay. Like if you want to go for a walk or go up to the lake or, something like that. But stay at least 6 feet away from others. I've noticed people doing this in front of my house. It's pretty cool. People walk I'd walk in front of my house all the time. And one person will just get down off the curb and walk around, and they get pretty far away from each other. So I thought that was pretty neat. People are noticing to do that.
Marianne, you did a great job compiling all this. And so the one thing is that the things you have there also apply to whether you're at home or whether you leave your home. So there's three general categories of things for people to think about. One is know where your hands are. Training yourself not to touch your face is something, whether you're at home or you're outside your home. It takes really being in the present moment to try to be aware of that, and it's a real challenge. And maybe you can remind each other when you're at home, hey, you're touching your hands, that we can help each other remember that. But it's really important to learn that particular part of the transmission of this virus. So maybe I'll just diverge just a little bit here. How do you get COVID-19? Number one.
We're going to get to that here. Yeah.
Should we get to that next?
Yeah, here's our next read. How do you get?
Okay. So basically 19. two big things on how do you get COVID-19. Number one, you touch someone who has the disease. Number two, you touch someone who's about to get the disease. So when we're talking about that, that's representing what we call droplet spread. Originally, they thought airborne was maybe one of the prevalent ways. Airborne means, aerosolized. You sneeze, and still, yes, if you sneeze, you should cover your cough by using your elbow or a Kleenex or something. But so we think that it may be airborne, but more so, it's the droplet. And so when the droplet gets on your hands and or on somebody else's hands, so that when we talk about how do you get it, touching someone who has the disease or touching someone who's about to get the disease, because you don't know if within a day or so that person doesn't know that they may develop it. And so not shaking hands with anyone. And then this leads to the things that people might have touched. So I have to tell you that one of the things we're doing at our office is we're pretty much we changed all of our appointments to telephone appointments, unless it is important that the person be seen in our office. And I have like a little spiel that I tell all my patients. You know, that the importance, first of all, is staying home and doing all these precautions. But if you go into the public, you have to do, whether you're actually at home or whether you're in the public, you have this 6 feet of social distancing. So that should keep you from touching other people. But what you don't think about is that any surface that you might touch when you leave your home could have been touched by someone who has the COVID-19. So a lot of people don't think about the touch screens. Okay, touch screens are, you know, at the debit machine, the gas station, going through the checkout line in the grocery store. All of these screens that you may touch may have just been touched by someone who has the infection. So you have to think about those. You have to think about any doorknob, okay? Any doorknob, getting in the elevator, touching, you know, the button for the floor. So what do you do? How do you avoid touching these things? If you have to touch them, then you should try to wash your hands as soon as you can. The general rule of thumb is 20 seconds. If you can do it 30 seconds, that's great. The 20 seconds thing they're telling you is sing happy birthday. By the time it takes you to sing happy birthday, that's 20 seconds. So you want to wash your hands for 20 seconds. But say you're not near a sink. So then what do? Hopefully you have either some Perel or some disinfectant wipes that you can wipe your hand as soon as you do that, as soon as you touch that. But you just do the very best you can to not touch your face. And until you can wash your hands, be aware that anything you have touched might have been touched by somebody else that has the virus. They have these Kleenexes that claim to be antiviral. Now, I don't know if they are truly antiviral, but they claim to be. But basically, any barrier between your hands and that surface would be helpful. But you want to throw it away right away. You don't want to be using, you know, a Kleenex at the debit machine and then take that Kleenex into your car. You know, so it's a challenge because you got to find a place to throw the item away. So these are a lot of things to think about, but if you understand the principle that you don't want to touch somebody, but you have to be aware of all these different surfaces that might have been touched by somebody. And if you do touch them, what do? Okay. And so are you still able to hear me okay?
Yeah, we're doing great.
Great. Okay. I want to tell you all,
with your spiel there.
Pardon me?
I said we got through quite a few slides with your talk. That was good.
Yeah.
Keeping our distance, using a barrier. You want to talk about N95 masks, whether people need them or not in the public?
Masks, yes, and I will get to that in just a second. Before I get to masks, can I tell you one more thing though about one of the references that I think it's important. I was searching for this topic of how long does the virus remain on these surfaces, and so for those of you who are interested, the New England Journal of Medicine on March the 17th of this year, they published a study, and it's the only study that I'm aware of that goes into this. And I don't know if you have that slide somewhere there, Marianna, but I can read off. This is what the findings were. On copper surface, the virus can remain alive for 4 hours. On cardboard, it could remain alive up to 24 hours. On stainless steel, could remain alive up to 48 hours. And the thing that stays alive on the longest is plastic, 72 hours. So I just as an example, I sent some packages to my sisters recently, and I told them to be on the safe side. There's nothing perishable in those packages. I said, let them sit for maybe a day, at least a full day, because literally, the cardboard, they were packed in cardboard, so that at the worst, the virus, if somebody dropped that package off that was infected, it could be sitting on the cardboard for 24 hours. So, if you can bring the packages in, and not touch it for 24 hours, that would be more than enough to make sure that it's not on any of those items. And the other thing, while I'm talking about that, because I know people can start getting a little paranoid about, and with good reason. I mean, I wouldn't say paranoid, but vigilant about what if somebody delivers pizza to the house or delivers, people are now buying their groceries and different things and having them delivered. I don't know if you're doing that much, if that's very available in Grays Harbor, but some of the grocery stores up here have started to do that. So, what people are doing is, when it's delivered, letting it set out there on the outside their door, they bring it in. If some people have gloves, they're using gloves to empty the items. If anything needs to be refrigerated, they're putting it away right away. Otherwise, if it's something that they don't need, they're just letting it sit in the bag for a while, so that to be on the safe side. So to be absolutely, like if it's I don't have a list for actually paper. I saw copper, cardboard, stainless steel, and plastic. They in general, that the CDC, the World Health Organization, they're not going into detail about these items. If you try to search for this information, you're not going to find it. The closest you're going to find about this information is this New England Journal article. And so that's why I wanted to point it out. And why does the CDC and World Health Organization not go into it? Well, maybe that they don't feel that there's enough evidence to make recommendations on this. But I know people are asking questions about it. So that's why I think, going to that reference is a good idea. Now, the I-95 mask. Okay, so the other reference, and I'll talk about this in the context of what I learned through this particular link that I know you're going to be sharing with your audience there, Marianna. There was an ICU doctor in New York City at Cornell that put a video out on this topic, as well as other topics. At Cornell, ordinarily they do heart transplants, major organ transplants. Their hospital has completely changed over to dealing with COVID-19 patients. And the doctor who has shared this video is the ICU doctor, the doctor that decides who is going to be put on a ventilator. And he is on top of all of the research and recommendations. And this topic came up of the masks, the N95 masks. And what he said, which I think is very valuable, which I think is reiterated elsewhere, is that the N95 masks should really be used by the frontline people, those who are in greatest risk of exposure, or if someone has indeed been confirmed to have COVID-19 and they don't want to expose their family, then it would be a great idea for that patient to have one of those masks, so as not to share, to expose the family to that. This particular doctor talked about if indeed a family member gets COVID-19, they should be in their own room, their own separate room, ideally their own bathroom. They could come out for a meal by themselves with their with their N95 mask on, and then eat, and then put it back. You keep it on whenever they're not eating. But for the population at large, they're not recommending to use the N95. Now, what about just any other kind of mask or a surgical mask? The reason for that, say someone is going out in public and they want to feel safer to put something on. Well, if they use any other kind of mask, the main thing it's going to do is it's not going to protect them from COVID-19 directly, but it's going to keep them from touching their face. This is the main point, is that it is so difficult for people to remember not to touch their face, that when they have a mask on, regardless of what kind of mask it is, a basic surgical mask, a mask that they got from Home Depot, that at least it's a reminder not to touch your face. It's one of those present moment things where it helps to keep you indirectly from contacting the COVID-19 virus. So if that helps, I thought that was valuable. And in this video, this ICU doctor very clearly emphasizes that. And and of course, everybody knows there's such a shortage of these supplies. So just to try to leave those items. I mean, if you have one, I would hang on to it. But if you're stockpiling them, and you can share it with some of the people on the front lines, like call your local hospital or the local clinics. I mean, the people who do the testing, okay, if they're fortunate to have enough test kits to be testing, those people who do the test should be fully geared, which includes that person doing the testing should have that N95 mask on.
Right.
Okay. So those are.
Can we go to the part where what to do if you think you're sick?
Okay. Yes. Okay. So what are the symptoms? Yeah. Let me go through the symptoms and then what to do exactly. Okay. Here's the four main symptoms or the five main symptoms: cough, sore throat, fever, body aches, and shortness of breath. Now, that's the bad one. That's the shortness of breath. So if you, right before I got on this session with you, Marianna, somebody sent me a text message. My daughter has a temperature of 100.1. What should I do? And my first question was, I only had a minute to communicate with her. I said, and this was a friend, this wasn't a patient, but I said, is she short of breath? Okay, that's the bottom line. They only want you to go to the emergency room or to a doctor's office, or not emergency room, but urgent care. Those two, urgent care and emergency room, if you are short of breath. If you are not short of breath, they really don't want you to go to emergency room. They don't want you to go to urgent care. If in doubt, you call ahead of time. Now, sometimes I think that can be subjective. What does short of breath mean? Because I know some patients, when their nose is real stuffed up, I've had patients tell me, I feel short of breath, but they really meant that their nose was congested. Now, short of breath is really, trouble breathing, and if you feel short of breath when you're sitting at rest, you definitely need to be in the emergency room. Or if you find, hey, I'm a little short of breath when I walk to the restroom, again, a sign to go to the emergency room. When in doubt, just go ahead and call them. Most of the emergency rooms, most doctors' offices now have all the triage questions. When you call them, they're going to tell you whether they think you should come in or whether you should just stay home. And so in other words, take this example, the person I just was communicating with, she has a fever of 100.8 or whatever it was, and sore throat and a cough. But if she's not short of breath, and maybe she has COVID-19, then the question is, should or should not that person be tested with the testing? And here's the big dilemma right now. Not all places have adequate equipment for testing. At our office, for 4 weeks, we had 10 kits 10 total. And we were told, do not test anybody unless they have they have had, the symptoms, the cough, sore throat, fever, body aches, and they've been exposed to someone definitely who had COVID-19, or they were traveling to one of the high risk locations, or were near one of the nursing homes in the Seattle area. They were telling us, even if you think they might have COVID-19, but they don't have any of those risk factors, send them home and tell them to self-isolate. You can imagine how we responded to that. It's like, oh my goodness. But that is what, that's, say that again?
For clinicians, that's got to be really hard.
Oh yeah. So, we had to tell people, I'm sorry, I cannot test you. I need you to go home. I need you to try to self-isolate. And if you start getting short of breath at any point, you need to call immediately or go to the emergency room if you get short of breath. Okay. Right. So I have to tell you, this is the first 4 weeks. Now we finally, this past week, we got more testing kits. And so now I think we have enough that if I really wanted to test someone, we could do it. And I also want to tell you, we don't test someone in our office. We do it out in the parking lot. This is the reason why people still have to be screened. They get a phone. If they want to come in, we're talking to them on the phone. We have nursing staff who talks to people on the phone, and we can now invite them to come to our parking lot. And we have 1 or 2 designated people who will go out there with all of the protective equipment on, including their N95 mask, and then they will be able to test them. So depending on where you are, just know that you may or may not yet be able to be tested, even though you think you might have it. But what you want to tell your provider is, if you know for certain that you were with someone who tested positive, or you were in one of the high risk locations, you just got back from Italy or China. If you have, they will ask you. They'll ask you all those questions, but it's not a guarantee that you'll be able to be tested. So unfortunately, we still don't. Not all facilities have the adequate testing kits yet. So know that.
Right.
The other thing. There were a few other things I wanted to go over. Questions that have come up, Marianna. The one about ibuprofen. Some people it was several different places. I actually saw it on TV, and people were asking me, and I finally came upon, in that video, the ICU doctor in Cornell. Okay. He said that the reference for that was Germany. There was data out of Germany that if you think you have COVID-19, you don't want to take ibuprofen because it showed a worse outcome if people used ibuprofen. And I don't know if that meant all of the anti-inflammatory medicines or just ibuprofen, but definitely it's better to use acetaminophen, which is the same thing as Tylenol. So I want to just diverge slightly on that anyway, because in general, we tell people stay away from the anti-inflammatory medications in general. We used to use them, for all different conditions, and I'll tell you why. We used to use these medicines a lot, but now we know all the problems that can result from anti-inflammatory, such as Motrin, which is also ibuprofen, Advil. I'm giving different names for these. Naproxen, Advil, Aleve. All of these they're called NSAIDs, anti-inflammatory medications. So these medicines, now you will know, not only has Germany determined that their COVID-19 patients have a worse outcome if they've used ibuprofen, but this category of medicines can make blood pressure go up, they can cause ulcers, they can affect the kidneys, and they can cause strokes. So in general, just like all your audience to know, we in general tell people stay away from the anti-inflammatory medicines. Unless you have liver disease, usually for most people, verify this with your doctor, but for most people, acetaminophen is safer. Acetaminophen is the same as Tylenol. That is your better bet. It's your better bet for COVID-19 and in general for pain, and it's better than the anti-inflammatory agents.
Great. Are there any other things that people might treat themselves at home with over the counter, like cough suppressant or an expectorant or vitamins or any kind of supplements? Is there anything like that that would be an over the counter medication that would help
Well,
people?
if people want to use any of those medicines to help symptoms, we always warn against, you know, the decongestants. Be careful with decongestants, and that's things like Sudafed. These can make blood pressure go up. And if you haven't had your blood pressure checked in a while, you don't want to take anything that has a decongestant in. So just be aware of that. But these other medicines, to treat the symptoms, sure, they could be used. And okay, I will tell you some data that someone shared with me, a link from Stanford, and I have not been able to verify it, although I received this from several different people. And yet, when you watch it on the news, they're saying, don't believe it. It was this thing about drinking water every 20 minutes. Have you heard about that?
Yeah,
If you think
I
you
got that
got the infection,
message. Someone said
yeah. Yeah, I guess it's controversial, but I don't know if it is controversial or if there is evidence of it out of the reference I saw is that it came out of Japan, that the Japanese doctors were recommending if you start getting a sore throat, that you should drink water every 20 minutes. And what would be the rationale for that? Well, okay, the only thing, I'm not, I'm speculating. That if, say, you got the virus in your mouth, okay, so you would want to get it out of your mouth. It would be good. You don't want viruses to be lingering in your nose and in your mouth, because you're going to inhale those into the lungs and then get pneumonia. So I could see a rationale about why that would theoretically be helpful, to be drinking water every 20 minutes. That way, if there's any in your mouth, you're kind of getting rid of it. But it's not proven. And when you watch the news, they say this is they talk fact or fiction. They're calling that fiction, but I want to, I did get, what's that?
It can't hurt to be well hydrated, I suppose.
Right. It doesn't hurt, really. What could it hurt to be well hydrated? Exactly. We know that it's a good idea to be well hydrated. And I'll tell you one more reason why there's a rationale behind that. When you think about nursing home patients, they tend to be, I would, when I've cared in the past for nursing home patients, they need to be encouraged to drink, and we know that as people get older, their sense of thirst decreases. They don't have an awareness of being thirsty.
Right.
So then you got the mouth, the mucous membranes that are dry, and so you could see where theoretically, the virus is around in that mouth, so maybe it might be inhaled easier. So theoretically, I can see that. And like I said, that there was a Japanese reference to this, but I don't know, if it's, I haven't seen it verified recently. But for what it's worth, it doesn't hurt to remain well hydrated, so I can say that.
Right.
So, yeah.
All right. Do you have anything else you'd like to tell us about, Tree?
Well, yeah, I just want to say, so the last three things, the most important things to prevent transmission, these last three things, everybody remember these. Number one, know where your hands are, and that goes along with training yourself not to touch your face. Okay, that is the most important thing. Okay. The second thing is wash your hands as often as you can. And certainly, if you think you've touched a surface that could have been contaminated or you're not sure, you want to be washing your hands. If you can get a hold of any of these disinfectant wipes to keep with you or Purell, all those things. The Purell supposedly, the virus supposedly is destroyed easily by Purell disinfectant wipes if you can get a hold of those. But if you can't, then you're just going to have to get somewhere where you can wash your hands. I guess I really have to talk about bathrooms, because think about it when you go into a public restroom. First, you got the door when you're walking in, right? So you want to use your elbow, or better yet, your foot to push the door open, okay? When you go into a stall, okay, think about any handle, any doorknob that you touch, higher is going to potentially be a source of risk. Okay, everybody should always use their foot, ideally, to flush a toilet, or use toilet paper to touch the handle of a toilet, to flush it. You don't want to have your direct hand on the flush, what you use to the handle you use to flush the toilet. And then you go out and then you wash your hands. And if you're lucky, you have the kind of sink where you just, it's motion activated and you can wash your hands. But most stores don't have those kind of sinks anymore. You have to put the handle on. So basically, you got to put the sink on and then wash your hands really good, and then get a paper towel, turn the sink off with the paper towel, and then immediately throw that paper towel away. So it is a real challenge going into a public restroom. And it's a real challenge going into any store, unless the store has doors that automatically open. And
Right.
and definitely when you go into a grocery store, most of them have these wipes. Be sure to wipe the handle on the buggy, the buggy that you're using, because that bar. Think of how many people are touching that. So,
Right.
and if they run out of those, okay, then you got to make sure you wash your hands as soon as you can when you're done. So those are the key things that I thought that I wanted to share with everybody. And then I think that it's kind of a long video, Marianna, that video, but it is so worth watching. The one by the Cornell
Yeah, we'll see
ICU
if we can
doctor.
put that link in the description box on the
Yes.
on.
Yeah, and it was posted on Facebook 5 days ago. Now I don't know when that doctor posted it, or the person who posted it was not the doctor but somebody else. So I tried to figure out exactly what day he videotaped that, so we know this information changes by the day. So it's a little dated because it was
Right.
posted 5 days ago. And and all the information that I have given today, it's best if you have questions, call. And I think you're also going to post your local, county health department should have a hotline to call for questions. And
Yes.
I know Washington State does, and the CDC. The CDC has a great site where it has a lot of the information. The CDC, Center for Disease Control, the WHO, World Health Organization, all these different levels of government and have something. All you have to do is Google COVID-19 and
Right.
WHO, and you'll get all of the different guidelines. And you will notice there's a little bit of difference from site to site. Most of it's pretty consistent, but sometimes there's a little variation. So, but Marianna, before I say anything else, I want to thank you so much for running for Washington State House District 19. I want to tell you, I'm so thrilled that you are running for this position. I met you through Whole Washington, which probably many of your listeners know that Whole Washington is the grassroots organization that's fighting and working so hard to make universal health care a reality in our state. even if it doesn't happen nationally, I know that you, Marianna, and so many other people with Whole Washington have worked so hard to try to make this a reality in Washington State. And by your running for this Washington State House, I'm just so pleased that you are doing this, and you have my full support. And I hope that everybody works very hard to get you. And I know there are others in whole Washington who I think are running for offices. Is that correct?
Yeah, Jason Call is on the board of Whole Washington, as is Rebecca Parson, and she's running in our CD6 in our congressional district. And then that's where we share the district. And then we have two other Our Revolution endorsed candidates in Washington, which is Joshua Collins, he's in the Olympia, Tacoma area running for Congress. And then Chris Armitage is over in Eastern Washington, as east as you can get, running for Congress as well. So I'm the only House Washington State level candidate for Our Revolution at the moment, but we got some congressional candidates, so that's pretty good.
Thank you so much for running. It is not easy to run. I mean, it's such a tremendous amount of time and effort away from your family. You know, you have so much on your plate, and so to be running for this, I thank you personally for running for this office, and I hope that everyone does all they can to get you elected, and all the people that you just mentioned. So just wanted to thank you again for all you do, Marianna. You're such a incredible progressive leader there in Grays Harbor. We are thrilled. Those of us in Clallam County who are working on the same issues, we all know who is our number one person in Grays Harbor. It's Marianna Everson. So thank you so much, Marianna.
Thank you. And thank you, Tree, for being here and lending us your knowledge. It's very important that we listen to doctors and nurses and scientists in this time, and I appreciate you giving us your time and being here for us. It's very
bet. And Marianna, I can be here a few more minutes. Are there any other and some questions that I can try to answer for at least a few minutes? Are you getting any questions right in yet there?
Are there any questions for the doctor?
Not specifically, but she could hang out and respond to the questions, possibly.
Sure.
Actually, we don't have a lot of questions, but I have a couple, and there is Carrie has some questions, I believe. Let me pull those up. She's working on them. One of the questions is, when it comes time, can you ask about the cases that have been reported with GI symptoms?
That's not one of the top 5. That's not one of the symptoms that have been listed as common. The main ones that they have listed have been cough, sore throat, fever, body aches. And I didn't say it, but just not feeling well is one of the things, one of the quotes I saw. And then finally the shortness of breath. So GI symptoms, it wouldn't be on the top of our list. It wouldn't make us think, oh, it's COVID. It's not in the typical symptoms. One thing I didn't say is that the duration of, if you do get COVID, it can be anywhere from 5 to 7 to 14 days in duration of those symptoms that I just mentioned. And in people who tend to have COVID and who are going to get short of breath, that usually happens between day 3 and day 5.
Right.
Is what the reference I saw. Yeah. And here's one of the really good things. This is a really good piece of news. Is that okay? So say you're in the hospital and you're going to get on a respirator. Hopefully, it doesn't happen to anybody. But that video actually, my source of information was the Cornell ICU doctor. He said that most of the people who go on a respirator because of COVID-19, most of them are going to come off, and they're going to come off within 7 to 10 days. Now, when he said that, long to be on a respirator, but at least he said that most people are going to come off. So, a lot of times people there's such fear of going to the hospital. And what he said is, go in, get in. It's day 3. If you are short of breath when you're sitting there, or you're short of breath, you start noticing, hey, when I get up to go to the bathroom, I'm kind of a little bit short of breath. I'm breathing a little bit faster. Then yes, go. Don't be afraid to go to the emergency room. But again, I would call them first. They may want you to go to a certain entrance. They'll give you guidance as to where
Right.
what they want you to do, and then they'll be expecting you. So it's a good idea to call ahead of time. But obviously, if you're real short of breath, you call 911. Yeah.
Yes.
But
Right.
going back again
Let
to
let
answer
those
GI
guys.
symptoms,
Yeah.
what's that? Yeah.
Let those guys take you to the emergency room. I have seen some um, just evidence, from nurses on some of the Facebook groups. We have some, groups for us nurses and other our medical professionals to, just de-stress and talk about things. We obviously
Uh
don't talk
huh.
about specific patients, but some people have said they saw some patients with some GI symptoms. And then I read an article earlier today where it said that there could be live virus in people's feces as well. So it's good.
Uh
People,
huh.
people working in medical facilities or nursing homes or hospitals, whatever, they know how to dispose of things and take care of things in the right way. But at home, people don't. So just make sure you're washing your hands after you use the bathroom. Make sure you report those symptoms to your doctor or the nurse line or whoever, and just be aware that any kind of anything that's coming out of your body is probably something that you don't want anybody to you know
Right. Yeah.
contact with.
And
Right.
the other thing, Mariana, people could get COVID-19, plus they could get other viruses simultaneously.
Right. Sure.
And or they could have eaten some food that's so yeah, it's a bad food, which again, infections. So you can have more than one infection going on at a time. But if in doubt, always call. And I think that most doctors' offices now, maybe not all, but a lot of them are trying to give that option of telemedicine so that you can
Yes. Mine
call
is.
and schedule.
Yeah.
Is yours doing that?
Yeah. I have Kaiser. They're doing that.
Yeah, really good idea. So that they can sift through these questions, if whether if you're having those symptoms and whether you should be seen or not. But like
Right.
I said, for the most part, the urgent cares and the ERs and the doctor's offices, for the most part, are saying, call ahead of time, and they're usually not going to bring you in. I know there's this a little bit of a dilemma. If say a patient thinks they have strep throat, okay, well that's something very different. That's going to be the call of the doctor if they want to see that patient, or say that patient was just next to. They said, my mom just was diagnosed with strep throat, and now and I have strep throat. So sometimes, although we don't like to treat with antibiotics nowadays, you may find that some doctors or providers may be a little bit more, err on the side of considering treatment empirically if, say, for sure, it has to be something, it's got to be the decision of the doctor of that patient because,
Right.
again,
Gotta
sore
be. You
throat
gotta.
could be
You
COVID,
gotta. Yeah.
could
Who
be
knows the person
COVID-19, it could be
that knows
strep,
them the best? Yeah. You
Yeah.
always want to go with the doctor that knows the person the best, right? All
Yeah,
right.
yeah, and that
We're
they
gonna.
can ask them all the right questions.
Yes. We're gonna move to the next section of the thing. So I want to thank you for being here, and
You bet.
we're gonna move on to other topics. So,
Okay, thank
all
you.
right.
And I
Thank you
hope
so much.
you all have a great evening, and
You
thanks
too.
again for running, Mariana, and thanks to
Yeah.
all of you.
All right.
Okay.
See you later.
Stay safe. Bye-bye.
Bye. All right. Well, thank you again to Tree. She's done a wonderful thing for us tonight to be here and be a leader in this. And I hope that you guys got some information that you can use to keep yourself safe and keep your family safe. And I want to see if there's any other questions before we move on.
Yeah, there's a question in YouTube about loss of taste and smell related to COVID-19.
Yeah, that's one of the symptoms. I think Tree did mention that as well, or I read it. Oh, sorry. But I did gather that information into my brain. That is typical with any kind of virus like this, or because the COVID, the coronavirus, named because of the look of it. You know, it looks like it has a crown, coronavirus. It is in the same family as our common cold. And so you notice when you get a cold, you don't taste things the same. And if your nose is stuffed up, that adds to it too. So it's common.
Now, Carrie had some questions. I believe they were pointed at Tree, but let me just go through them so they get aired. Maybe you can offer some answers. How many cases are you seeing pop up and in your area or clinics around you? That's number one.
Okay. I don't know how to answer that.
Okay,
'Cause I don't
is there anything you need from us? And I assume this was for Tree again, those of us who are listening. Ways the public can help besides staying at home. You want to reiterate your positions on that? And
Absolutely. So yes, it's staying home and staying well yourselves, taking care of your families. Stop hoarding the toilet paper. If you have access to personal protection equipment like masks or gloves, um, if you would please donate that to your local hospital, fire department. Um, those people that are working in those jobs are putting themselves on the line every single day to care for people that are very sick, and they could become sick themselves without the proper equipment. So, until we get our supply chain thing figured out, if you have some masks, please consider donating them to the fire department or the local hospital.
okay, since you answered in such a way, some people may think that they are not inclined to go out of the house to take them to the local hospital or fire department. And I'm
If they contact those entities, I'm sure they would arrange for
somebody to grab them,
no,
pick them up, put them out on
pick
the
'em.
front porch or something.
Yeah.
Okay, the other question, or actually, it's a reminder that we need to use clean towels every shower if you're, especially if you're sick and with, gastrointestinal issues. Just, as a housekeeping point of hygiene. Um, do you mind if I jump in with a couple of my questions on this?
Oh, it's fine.
Okay.
Yes.
I'm quite familiar with electrolysis, i.e., the Kangen machines. They have a pH setting of 2.5, which in Japan, that's how they use to sterilize surfaces against bacteria and viruses. The setting of that water, what I do is put it in a spray bottle, so it's kind of like when we go out, or if there are surfaces in question or any contact, we spray those down with our gloves with the pH acidic water from electrolysis. What's your feeling on that?
My feeling, if it makes you feel safer, then that's great. I don't have any research done myself personally on that. But I feel like if you feel like that's helpful, then that's good. Um, as long as you're doing the other things that you mentioned too. You're wearing the gloves, you're not touching your face, you're washing your hands. I can't see where that would be something something that would be bad. Sorry, somebody was making a face at me.
No, that's fine. A lot of people do have Kangen machines, and um, I've got a couple of scientific papers open here that says that high pH acidic water does clean bacteria and viruses off of surfaces. So that might be something that I would suggest people look into because
Will you share that with me? That'd be interesting.
yeah, the because as far as getting the cleaning products that you need to go after bacteria and viruses now might be a little difficult.
Right.
But that's just one more option in your toolkit to do that. I know that if we put it out there, at least as best we could suggest that after you and other people, look into it, because I haven't seen that, but I can run that through my Kong machine by the gallon and like put it out for people to have as a alternative disinfectant. But again, this is I'll give these links to you so we can put them in the rundown. It's really a big thing, and ending my point on that is that staph infection has been treated with Kangen high acidic, or it doesn't have to be Kangen brand, but they've been vetted by many researchers that helps clean the surfaces and the pores of your skin from bacteria and viruses. So again, I think it's something to at least look into.
Yeah, thanks for sharing that. That's
yeah, I'm always looking for new information, but it has to be properly vetted. But I will share those links out so you can see it.
All right,
That's just
great.
one of the tools involved. Let me see if there's some more questions. And I thought I had a couple. Let me see. No questions coming from Facebook so far. Moving right along, Marianna.
All right. Well, I was hoping to have other people direct the conversation, so I guess I'll just talk a little bit about my platform. We've been sharing the platform quite a lot on social media, and I think that it's getting out there. We talked about it a little bit on one of the other live streams, so I'm going to go to a different section this time. I'm pulling it up. Some of the questions that I've gotten from the community um, while I'm waiting for this to load have been they wanted me to do somebody asked me to please do something like this where I was sharing my nursing knowledge, having someone that it was an expert. Well, luckily I'd already asked Tree to do this because it's important for people to have the facts and to listen to the medical personnel and the scientists and all of that, um, and not just go off of what they heard down the street or from someone who doesn't research this or know, and then do things that um, might not help people, that might hurt people. So uh, I intend to keep listening to the public and direct my platform toward what they want and what they need. So we talked about healthcare, and last night I participated in a whole Washington Medicare for All town hall with Our Revolution, and so I truly enjoyed that experience. I'm excited to be on a team of people who are going to be working as hard as they can to make it so we all have a single payer, nonprofit, guaranteed health care service. And I will keep fighting for that until it's done. I'm not going to ever stop. So I just wanted to reiterate tonight what I had hopefully gotten across yesterday, in that when I get to Olympia, I will be championing this whole Washington Health Trust. I will be doing everything that I can do to make sure that we bring this bill or support the initiative, if that's the route that we are doing, um, to the floor, get it passed, and get people care. Because if we had a healthcare system where people didn't have to worry about paying a copay or how much their deductible was, or if they even have health insurance at all, people would have gotten the care that they needed at the first sign of illness. And we might have been able to contain this. We also could have been able to do the testing that was needed to control the spread of this virus across our state and our country. So I will keep, this has just given me more fuel in my burn to make sure that this happens, that in my lifetime, we will have a Medicare for all single payer system. And by passing it in Washington, we can light a fire that will spread across this nation and make it so everyone has um, what we have been denied our entire life. Every other major country on earth has a single payer or a universal healthcare system. And our whole life we've been gypped. And I'm not going to sit back and watch it keep happening for my kids and my grandkids. So that's on my platform. What it says is boldly create a system that promotes health, protects life, and frees Washingtonians from medical debt by being free at the point of care and covering all essential health benefits, including hospital care, primary care, mental health, drug treatment, prescription medications, dental, hearing, and vision. And there are also more, but we can organize our healthcare system in a different way so that we take the profits out of it and we all save money. We all still pay. It does cost something. I know I keep getting people say things cost things. Yes, they do, but we do not have to do without the healthcare that we need just so some companies can make a whole bunch of money. And I think that's morally wrong.
Do you have any thoughts on the physician, Dr. Lynn up in Bellingham, that was fired the other day for speaking out
Yeah,
about protective
I
gears?
read that article. That is ridiculous. One of the only arguments that I saw against him in my circle, and I'm going to say, acknowledge that my circle, my bubble is my bubble, and it's not going to be everybody's bubble, was that they hoped that he had gone to the administration before he made such a stink. And I can't imagine a professional not doing that.
I agree,
He's a doctor.
absolutely. A 17
I
year,
cannot.
17 years. I mean,
Yeah,
come on, you know.
I'm sure he went to the administration about it. But yes, we all need to do that. Uh, and if they can't fire us all, but if your facility is not doing everything that needs to be done, that can be done, like yes, sometimes there isn't anything you can do, right? I mean, we have a national shortage on masks and PPE. I see that, that sometimes they can't do anything. But if there's stuff that can be done, these administrators need to be listening to the healthcare professionals on their recommendations on what we should be doing. Yes, test people outside, not inside. Duh. I mean, everybody was doing that. Whatever it was. That it's just a tragedy for a hospital to lose an ER doc in this pandemic when people need him. That's just tragic.
A couple
Totally
of
tragic.
points on that. Peace Health is supposed to be a nonprofit organization, and my question to you
Right.
is
Supposed to be.
how do you perceive a nonprofit organization paying their chair, their executive, $1.5 million a year, and on down the line, we know that everyone on that board probably is in the six-figure range. Now, isn't that kind of an oxymoron? Instead of making the wage for the job equivalent to the standard of for-profit institutions across the country? I mean, really?
Definitely, our hospital systems need to be reformed, and they need to be regulated or somehow changed from what they
Nationalized for
are.
Medicare for all, would that do it?
That would be lovely. But hospitals are charging $6,000 for a test for a CT scan on a machine that does not cost $6,000 a piece to run. To pay the two techs or three or whatever it is on that day, And to run the machine and to pay the lease on that machine does not cost $6,000 per person that goes through the tube. That's ridiculous. CEOs in these hospitals are making way too damn much money, and not-for-profit healthcare systems like Providence and Peace Health are running their systems as for-profit systems. They're not running them as not-for-profit. They are making a profit. That's ridiculous. We're gonna change that. We got to change it.
Well, Carrie says that the wages need to be competitive. Both sectors need to come down, and I agree with that to the point of they need to be competitive, but they shouldn't be in a lane of for-profit. Anyway, that's the thing. Either side, the for-profit institutions and the nonprofits. And when they say nonprofits, as we see, well, somebody sure as hell profiting off of this. And if it's just the CEO and the executive board, that's for-profit. Period. There's no argument that I can think of against it. But Carrie's point is well taken. She says that if they
in the job, you have to pay the prevailing wage, right?
Right. And
I get that. But if across the board, all the hospitals, the prevailing wage is an actual, fair wage, then and they want people to do that job, then they can just train people to do that job. People need to go to school anyway. There's people that want to up and coming that want jobs like that. We do not have to cater to CEOs who want to make 300 times more than the average worker.
Or 1,000 times with golden parachutes in excess of $1 billion, United Healthcare.
Exactly.
So that's,
exactly.
That's the thing. I've challenged on my own behalf and in support of Whole Washington and other, Medicare for All groups, anyone in social media and out of social media to have the discussion in a debate form. I am confident that either myself or those who I am on a debate panel with can pretty much shred any arguments coming from the other side of the issue, because it is a matter of life and death. Medicare for all, health care for all is a human right, and that's where the buck stops, period. There is no debate. So anybody who would like to, anytime, anywhere, but I don't have to argue with them because I know I'm right.
Yeah.
So
and we don't have to argue with one another.
No, not at all. I mean, it's like, you think this virus, this pandemic is exactly why we need national Medicare for all. And I would even take it a step further. The whole damn world should adopt it, no matter what country, wherever, third world or otherwise. We as multinational countries should just make actual health care a right for every human existing on the planet. And I can go on for days.
Me too. Well, Oz, that sounds like a really good place to stop. It is 8:30, and we could go on a little bit longer if there's more questions out there. But I think if we change the topic to something else, my platform, it might get a little bit lost. So leaving it with the healthcare topic is probably a good idea.
Well, that's
Are there
what.
Any other questions that are coming out? And if not, let's wrap her up.
Carrie said if they go after nonprofit community-based hospitals, it will negatively impact patients in smaller communities. Thus, the conversation we had. We just can't have that, and we do have to get Medicare for all before. As we get through this pandemic, we've got to be able to walk and chew gum, and before the next series of possible pandemics happen with climate crisis. So thanks so much, Marianna, for this wonderful town hall event. It was a little clunky out of the gate, but I think we got it taken care of. What do you think?
Yeah, I think it's been good.
Next week, same time, same channel. Is that what we're shooting for?
Yep.
All right.
Yes, please. Every Sunday, 7 p.m. We'll be here, and we'll choose a new topic next week.
Okay. Thanks. Good night, everybody. Thank you so much.
Good night.
Till we meet again next week.